Results: a total of 303 older adults were enrolled, and all-cause mortality was 21.8%. The study population was categorized by CONUT score. Patients in CONUT score 5 to 12 had a higher age, ASA status, CRP and creatinine level, more patients with history of fracture, pneumonia and delirium. Meanwhile, lower BMI and ADL score, lower hemoglobin, lymphocyte, total protein, albumin, triglyceride, total cholesterol and 1-year survival than those in CONUT score 0 to 4, all p less than 0.05. Multivariable Cox analysis showed that BMI, ADL score and CONUT score were independent risk factors for all-cause mortality of hip fracture in older adults. HR, 95% CI 2.808, 1.638. For 0.814, p less than 0.001, 2.862, 1.637, 5.003, p less than 0.001, 2.322, 1.236, 4.359, p equals 0.009 respectively. More importantly, the combined index of CONUT and ADL score had the best predictive performance based on ROC curve, AUC 0.785, 95% CI, 0.734 to 0.830, p less than 0.0001. Kaplan-Meier survival curves for all-cause mortality showed that patients with CONUT score increase and ADL score impairment had a higher mortality rate at 1 year compared to CONUT score decrease and ADL score well. Log-ranked Chi2 equals 45.717, p less than 0.0001. Conclusions: combined CONUT and ADL score is associated with 1-year mortality after hip fracture surgery for geriatric patients. PMID 388497114DI 10.1007/S40520-024-02786-8. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Combined nutritional status and activities of daily living disability is associated with 1-year mortality after hip fracture surgery for geriatric patients, a retrospective cohort study. Title: VR-related evidence matrix. Malnutrition-related health outcomes in older adults with hip fractures, a systematic review and meta-analysis. Outcomes following hip fracture surgery in adults with schizophrenia in Ontario, Canada, a 10-year population-based retrospective cohort study. Comment on the association of preoperative frailty with the risk of postoperative delirium in older patients undergoing hip fracture surgery, a prospective cohort study. Risk factors influencing periprosthetic fracture and mortality in elderly patients following hemiarthroplasty with a cemented collarless polished taper stem for an intracapsular hip fracture. Osteoporosis management in adults with schizophrenia following index hip fracture event, a 10-year population-based retrospective cohort study, Ontario, Canada. Safety profile of hypnotics or sedatives on Acta Medport. 2024 June 3, 37, 6455-466. doi 10.20344/AMP20969. EPUB 2024 June 3. Abstract. Introduction. Psychiatric comorbidities have a significant impact on patients' quality of life and often go undetected in neurologic practice. The aim of this study was to describe and characterize psychiatric comorbidities among patients hospitalized due to a neurologic disorder in mainland Portugal. Methods. A retrospective observational study was performed by analyzing hospitalization with a primary diagnosis of neurologic disorder defined as categories 76, 77, 79 to 85, 95. 109 of the Clinical Classification Software for International Classification of Diseases, 9th revision, clinical modification, occurring between 2008 and 2015 in adult patients, greater than or equal to 18 years of age. Psychiatric comorbidities were determined as the presence of a secondary diagnosis belonging to the clinical classification software categories 650 to 670. Results. A total of 294,806 hospitalization episodes with a primary diagnosis of a neurologic disorder were recorded in adult patients between 2008 and 2015 in Portuguese public hospitals. Approximately 26.9%, N equals 79,442, of the episodes had a recorded psychiatric comorbidity, 22.1%, 32.2%, female versus male hospitalizations. Patients with registered psychiatric comorbidities were younger, 66.2 plus or minus 16.2 versus 68.6 plus or minus 17.2 with no psychiatric comorbidities. P less than 0.001, presented lower all-cause in-hospital mortality rates, and significantly longer mean hospital stays. Delirium, dementia, amnestic, and other cognitive disorders were recorded in 7.4%, N equals 21,965, of the hospitalizations, followed by alcohol-related disorders in 6.5%, N equals 19,302, and mood disorders in 6.1%, N equals 18,079. Epilepsy/seizures were the neurologic disorders with the highest proportion of recorded psychiatric comorbidities, 39.9%. Conclusion. Psychiatric comorbidities Earth 4K Mini Space Video I copy link. Earth 4K Mini Space Video I copy link. Free full text. Review. Loneliness and coping styles among athletes with disabilities during the COVID-19 pandemic. Piotr Kazimierz Urbanski, Tomasz Taziemski, Kingsley Schroeder, Magdalena Lewandowska, Lukasz Bojkowski. June 2024. Humans COVID-19 Loneliness Adaptation, Psychological Male-Female Longitudinal Studies. Adult Disabled Persons Athletes SARS, SO-V, 2 Young Adult Pandemic Sports for Persons with Disabilities. Para-Athletes. Abstract, full text related. Save. The Newborn Behavioral Observation System, a relationship-building intervention to support families in the neonatal intensive care unit. Lee C. Johnson, Beth McManus, Yvette Blanchard, J. Kevin Nugent. June 2024. Abstract, full text related. Save. Perspectives of Service Providers on Vocational Rehabilitation for Mental Health Service Users in Namibia, a qualitative study. Munyradzi Chimara, Hester Van Biljon, Faslow and Adams, Lana Van Niekerk. June 2024. Abstract, full text related. Save. Goodbyes Without Farewells Under the Rubble, a phenomenological study of earthquake victims' methods of coping with ambiguous loss. Gubra Guillermac Guler, Ida Albayrak. June 2024. Abstract, full text related. Save. Identifying Patterns of Multidimensional Self-Compassion in Chinese Young Adults, Implications for Longitudinal Mental Health Outcomes During the Pandemic. Yizhen Rin, Luwei Huang, Ing Zhang, Di Zhang, Xinli Qi. June 2024. Abstract, full text related. Save. More. Avoidant Restrictive Food Intake Disorder, Recent Advances in Neurobiology and Treatment. Natasha K. O. Fonseca, Vittoria D. Curtarelli, Giuliana Bertoletti, Julia D. Morera, Luciana C. Antunes et al. June 2024. Abstract, full text related. Save. Effects of intensive lifestyle changes on the progression of mild cognitive impairment or early dementia due to Alzheimer's disease, a randomized, controlled clinical trial. Dean Ornish, Catherine Madison, Maya Kivapelto, Rudolph E. Tanzi, Stephen E. Arnold et al. June 2024. Humans Male-Female Aged Cognitive Dysfunction Alzheimer Disease Progression Aged 80 and Over Lifestyle Middle-Aged Dementia Amyloid Beta Peptides Neuropsychological Tests Treatment Outcome. Abstract, full text related. Save. Free. Full text. Review. Loneliness and coping styles among athletes with disabilities during the COVID-19 pandemic. Piotr Kazimierz Urbanski, Tomasz Taziemski. Medicine, Baltimore. 2024 June 7, 103, 23E38418. DOI 10.1097/MD.0000000000003848. Abstract. Background. Previous findings on the effect of general versus spinal anesthesia on postoperative delirium in elderly people with hip fractures are somewhat controversial. This article included the latest randomized controlled study for meta-analysis to evaluate the effect of general anesthesia, GA, and spinal anesthesia, SA, on delirium after hip fracture surgery in the elderly, so as to guide the clinical methods. Cochrane Library, PubMed, Web of Science, and Embase were searched from inception up to January 16, 2024. Randomized Controlled Trial, RCT, was included to evaluate the postoperative results of GA and SA in elderly patients, greater than or equal to 50 years old, undergoing hip fracture surgery. 2 researchers independently screened for inclusion in the study and extracted data. Heterogeneity was assessed by the I-2 and chi-square tests, and p less than 0.1 or I-2 greater than or equal to 50% indicated marked heterogeneity among studies. The Mantel-Haenszel method was used to estimate the combined relative risk ratio, RR, and the corresponding 95% confidence interval, CI, for the binary variables. Results: 9 randomized controlled trials were included. There was no significant difference. RR equals 0.93, 95% CI equals 0.774 to 1.111, p greater than 0.05. In the incidence of postoperative delirium between the GA group and the SA group. In intraoperative blood transfusion, RR equals 1.0, 95% CI equals 0.77 to 1.28, Z equals 0.04, P equals 0.971, pulmonary embolism. RR equals 0.795, 95% CI equals 0.332 to 1.904, Z equals 0.59, P equals 0.606, pneumonia. RR equals 1.47. 95% CI equals 0.75 to 2.87, P equals 0.675, myocardial infarction. RR equals 0.97, 95% CI equals 0.24 to 3.86, Z equals 0.05, P equals 0.961, heart failure. RR equals 0.80, 95% CI equals 0.26 to 2.42, Z equals 0.40, P equals 0.961. Urinary retention. RR equals 1.42, 95% CI equals 0.77 to 2.61, Z equals 1.11, P equals 0.267, were similar between the two anesthetic techniques. Conclusion: there is no significant difference in the effect of GA and SA on postoperative delirium in elderly patients with hip fracture, and their effects on postoperative complications are similar. PMID 3884760 doi 10.1097/MD.0000000000003848. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. JNS 2024 June 7th. DOI 10.1007/S00540-024-03358. W. Online ahead of print. Abstract. Anesthetic management of pediatric patients poses several challenges, and the optimal anesthetic agent for use in this population is still a matter of debate. We systematically searched PubMed/Medline and Google Scholar from their inception for studies that investigated the role and potential applications of remimazolam, a novel ultra-short-acting benzodiazepine, in pediatric patients. Furthermore, in March 2024, an update of the literature search along with an additional post-hoc search on the Embase database were performed. A total of 14 pertinent studies which span the 2021 to 2023 period explored remimazolam as either the primary or adjuvant hypnotic agent for inducing and/or maintaining general anesthesia or sedation. Preliminary evidence derived from these studies highlighted that remimazolam Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Remimazolam for anesthesia and sedation in pediatric patients, a scoping review. Title: VR-related evidence matrix. Remimazolam for anesthesia and sedation in cardiac surgery and for cardiac patients undergoing non-cardiac surgery, a systematic narrative hybrid review. Effect of remimazolam on emergence delirium in children undergoing laparoscopic surgery, a double-blinded randomized trial. Effect of remimazolam on emergence delirium in children undergoing laparoscopic surgery, a double-blinded randomized trial. Utility of remimazolam for fast-track recovery following surgical aortic valve replacement in an elderly patient with severe aortic stenosis, a case report. The rise of remimazolam, a review of pharmacology, clinical efficacy, and safety profiles. Comparison of remimazolam and propofol on postoperative delirium in elderly patients undergoing radical resection of colon cancer, a single-center prospective randomized controlled study. Shining a light on trace elements, a systematic review and meta-analysis of serum concentrations in febrile seizure. Shining a light on trace elements, a systematic review and meta-analysis of serum concentrations in febrile seizure. Extraskeletal intracranial mesenchymal chondrosarcoma, systematic literature review. Machine learning in the prediction and detection of new-onset atrial fibrillation in ICU, a systematic review. Post-traumatic growth among pediatric transplant recipients and their caregivers, a scoping review. Cardiovascular disease in patients with metabolic dysfunction-associated steatohepatitis compared with metabolic dysfunction-associated steatotic liver disease and other liver diseases, a systematic review. Cardiovascular disease in patients with metabolic dysfunction-associated steatohepatitis compared with metabolic dysfunction-associated steatotic liver disease and other liver diseases, a systematic review. Continuation of pediatric care after transfer to adult care among autistic youth, overlap of pediatric and adult care. Management of high-acuity patients in pediatric medical settings, the role of consultation/liaison psychologists during the growing mental health crisis. Exploring the impact of music on response to ketamine/esketamine, a scoping review. Family systems approaches in pediatric obesity management, a scoping review. Scoping review. Digital mental health interventions for children and adolescents affected by war. Pediatric suicide. Review of a preventable tragedy. Outcomes with general anesthesia compared to conscious sedation for endovascular treatment of medium vessel occlusions. Results of an international multicentric study. The relationship between schizophrenia or schizoaffective disorder and type 1 diabetes mellitus, a scoping review of observational studies. Best practices for the management of febrile seizures in children. A silent scream in the pediatric emergency department, child abuse and neglect. Practical guidelines for eating disorder risk mitigation in patients undergoing obesity treatment for the pediatric provider. Practical guidelines for eating disorder risk mitigation in patients undergoing obesity treatment for the pediatric provider. Pharmacological treatment for terminal agitation, delirium, and anxiety in frail older patients. The role of pediatric psychologists in critical care, lessons learned and future directions in integrating mental health care into pediatric intensive care units. Scoping review. The role of psychedelics in the management of chronic pain. Prevalence of Rome-4 Pediatric Diagnostic Questionnaire assessed disorder of gut-brain interaction, psychopathological comorbidities, and consumption of ultra-processed food in pediatric anorexia nervosa. Treatment of patients with anorexia nervosa and comorbid post-traumatic stress disorder. Where do we stand? A systematic scoping review. The relationship between spirituality and religiosity with death anxiety among cancer patients, a systematic review. Pediatric pharmacology for the primary care provider, advances and limitations. Global clinical presentations and diagnostic application of proposed biomarkers in psychiatric onset prodromal dementia with Lewy bodies. June 6, 2024. Evidence. Psychogeriatrics. 2024 June 4th. doi 10.1111/PSYG.13147. Online ahead of print. Abstract. Research criteria for the diagnosis of prodromal dementia with Lewy bodies, DLB, include 3 clinical subtypes: mild cognitive impairment with Lewy bodies, MCILB, delirium onset prodromal DLB, and psychiatric onset prodromal DLB. Late-onset psychiatric manifestations are at a higher risk of developing dementia, but its relation to prodromal DLB remains unclear. In addition to the risk of severe antipsychotic hypersensitivity reactions, accurate discrimination from non-DLB cases is important due to the potential differences in management and prognosis. This article aims to review a rapidly evolving psychiatric topic and outline clinical pictures of psychiatric onset prodromal DLB, including the proposed biomarker findings of MCLB. Polysomnography confirmed rapid eye movement sleep behavior disorder, cardiac, 123I, methiodobenzoylguanidine scintigraphy, and striatal dopamine transporter imaging. We first reviewed clinical pictures of patients with autopsy-confirmed DLB. Regarding clinical reports, we focused on the patients who predominantly presented with psychiatric manifestations and subsequently developed DLB. Thereafter, we reviewed clinical studies regarding the diagnostic applications of the proposed biomarkers to patients with late-onset psychiatric disorders. Clinical presentations were mainly late-onset depression and psychosis. However, other clinical manifestations were also reported. Psychotropic medications before a DLB diagnosis may cause extrapyramidal signs and potentially influences the proposed biomarker findings. These risks complicate clinical manifestation interpretation during the management of psychiatric symptoms. Longitudinal follow-up studies with standardized evaluations until conversion to DLB are needed to investigate the temporal trajectories of core features and proposed biomarker findings. In patients with late-onset psychiatric disorders, identification of patients with psychiatric onset prodromal DLB provides the opportunity to better understanding the distinct prognostic subgroup that is at great risk of incident dementia. Advances in the establishment of direct biomarkers for the detection of pathological alpha-synuclein may encourage reorganizing the phenotypic variability of prodromal DLB. PMID 3883769DOI 10.1111/PSYG.13147. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research.